bit of a troubled time. But the next few minutes, we're going to talk about two important aspects of what we are going through. One is the COVID-19 pandemic, and two is the cancers, the management of cancers, the treatment of cancers, especially in the era of this COVID-19 pandemic. There's a nice saying that goes, time and tide waits for none. Unfortunately, we probably have to add on the tumor into this as well. Time, tide, and tumor waits for none. We all know extensively about the COVID-19. There is certainly an extreme amount of anxiety, fear, ignorance associated with this. No doubt, the whole world is facing this, and there are some countries out there who are actually on the path of getting better. We certainly are on the uphill, and that is the reason we are seeing so many cases. We've been juggling around this COVID-19 probably for the best part of about 3 months now. Coming with it is the enormous payments we are doing in terms of sacrificing the health. Not only physical health, mind, the mental health, psychological health, and the financial health too. The lockdowns have helped to an extent, but they have their implications. When such is the case, what is happening with the clinicians, with the doctors? Doctors are humans too. Unfortunately, we also started losing lives amongst the clinicians, amongst the doctors for this pandemic. Nevertheless, we're all fighters, we're all survivors. That's how Homo sapiens is surviving till today. Hence, we need to put a plan in place. We need to at least get a plan for the time to come to see how we proceed. There has been an extreme amount of anxiety, fear amongst the surgical community, amongst the doctors community, whether we should be operating at all. If it is a cosmetic procedure, for example, if it is a dental procedure, for example, if it is a non-cancerous condition like a hernia, it can probably wait. However, the emergencies can't wait. Somebody with a hole in the bowel, they can't wait. They shouldn't wait. Somebody with bad appendicitis, they can't wait. Somebody who has an ectopic pregnancy, for example, they can't wait because they're all life-threatening. However, coming to cancers, it is actually an epidemic we are facing in this era, probably related to the lifestyle we are going through. What do we do about cancers? Again, cancers are not a box of fruits. There are early cancers, there are late cancers. There are cancers that can wait, which are slow growing. There are cancers that can't wait. There are cancers which present with obstructions. I'm a colorectal surgeon by trade. I deal with all the bowel cancers and the peritoneal and the tummy cancers. The cancers which come as an impending blockage, where people present with symptoms. ಕನ್ನಡದಲ್ಲಿ ಲಕ್ಷಣಗಳು ಅಂತ ಹೇಳ್ತೇವೆ. People present with symptoms of abdominal distension, ಹೊಟ್ಟೆ ಊತ, pain, ನೋವು, inability to eat, ಊಟ ಮಾಡ್ಲಿಕ್ಕೆ ಸಾಧ್ಯವಾಗದೇ ಇರತಕ್ಕಂಥದ್ದು, and vomiting, ವಾಕರಿಕೆ. ಹೀಗೆಲ್ಲ ಆದಾಗ, when such is the case, these are patients who might be presenting to us with an emergency, and surgeries cannot wait in these difficult times. Or it could be somebody with a rapidly progressing cancer, where we do not have time, or at least a long time to wait. We have gone through really 3 months now, at least in India. I suspect we probably have many more months to come to terms and flatten the curve, as we say, with regard to the COVID-19. I think Cancers are no doubt a huge problem today. What needs to be told both to our patient population as well as to the clinicians is there are some surgeries that cannot wait, that shouldn't wait. Life takes a priority than everything else. And these surgeries have to be undertaken and are undertaken with appropriate measures, with appropriate safety precautions, and with appropriate awareness. So, ladies and gentlemen, can cancers wait in an era of COVID epidemic? Some of them can, but majority of them cannot wait during this period of COVID-19. Emergencies certainly take a priority and they cannot wait. Is there a danger when we operate in the era of COVID-19 pandemic? Yes, there is a risk. But I think it is about understanding the process, understanding the risks, not only just understanding it, communicating that risk to your colleagues who work with you, to your anesthetic team who work with you, to the OT practitioners who help you out, to the patients who actually go through the surgery, to the families whose family members are going through surgery, to the administrative people so that adequate protective mechanisms are in place. SOPs are in practice and in place. Guidelines are taken care of, and also the policymakers, the government, which should support the whole process. So in summary, ladies and gentlemen, I think cancer is an epidemic, no doubt, and we are clubbed the cancer with the COVID-19 pandemic currently. There is certainly an element of anxiety, anxiousness, fear, ignorance associated with cancers in this period, both amongst the clinicians as well as the patients and their families. It is important we understand that cancers take a priority, and there are some cancers when they present with emergencies, the options are limited and we have to operate. Majority of the cancers cannot wait because they can progress, causing complications, and some of the cancers can wait. But it is important we create that awareness amongst general population, the clinicians or the professionals, the policymakers and the government, put adequate safety measures in place, whether it's about face masks, whether it's about wearing adequate personal protective equipment, as we call it PPEs, keeping the interaction of people to bare minimum, keeping the visitors to the patients to bare minimum, and undertaking the procedure with utmost precaution. Despite all this, there are possibilities that there can be a problem related to COVID-19 in the patients, and that is the time you need a place like Apollo Hospitals, which is a COVID-ready hospital, which means there is screening, there is surveillance, there is diagnosis, there is isolation, there is quarantine, there is treatment, therapy, and if need be, there is a fully fledged ICU facility where this can be taken care of, in addition to the COVID testing that are done. The normal standard procedures, which are non-COVID, can be attended easily in a separate pathway. But when we are ready for, eventuality of the COVID crisis, this is the place to be in, I think. So, ladies and gentlemen, in summary, cancer is a big problem. Added on to that is the COVID-19 pandemic that is going through. At this particular juncture, it is about thinking sensibly, being safe, being secure, and doing a sensible job protecting the patients as well as the clinicians at large. I'm happy to take any questions if they're coming through online at this juncture. And truly, we are in a difficult time, but as I said, probably we will pass through. The storm has kicked in. We just want the storm to calm down. The after effects that the storm leaves has to be dealt with, and I'm sure the government, the policymakers, the hospitals, and population at large is doing a reasonable job. Thank you.
Thank you very much, doctor. That was a helpful talk. We don't have any questions as of now.
So we'll wait for the questions. People might take some time. Meanwhile, doctor, I have a question for you. One is that cancer doesn't wait for anyone. Like if there are more people, the incident rate is also high in India. And people in times of this COVID, delaying a treatment for cancer, what will it cost? You have to share anything on this matter?
See, people see cancer as a huge devil. People see it's a monster, a devil, an evil. But frankly speaking, cancer is probably an evolutionary process in one's lifetime. We all know that the longer we live, there is a good possibility that you might have a type of cancer. The Western data says if you live up to 80 years, 1 in 3 will have a cancer of A type at some point in your lifetime. So I think aging certainly is a risk factor, or living longer is a risk factor, longevity. And I think we should see this as a part of evolution. And it is this taboo we have to come out of, saying that it is an evil thing. The second thing I want to emphasize is cancers are curable, provided you pick up the cancer at an early stage and it is an early cancer. We can attain a complete cure, majority of the cancers, if they're picked up early. But the problem with a country like India is we don't go to the clinicians at an earlier duration, at an earlier time, so that early cancers are picked up. It is surprising as well as shocking to know that more than 2/3 of the cancers, about 65 to 70%, if not more, of the cancers that we see present at a stage which is advanced, stage 3, stage 4, where this particular cancer has actually moved on to different parts of the body, necessitating chemotherapy, targeted therapy, etc., in addition to dealing with the primary cancer, or sometimes without dealing with the primary cancer. So I think this is the most important thing that we have to drive to the community as a whole, that cancers are curable provided we pick them up early. And it is important that when we have any type of symptom, ಕನ್ನಡದಲ್ಲಿ ಲಕ್ಷಣಗಳು ಅಂತ ಹೇಳ್ತೇವೆ, any type of symptom, to attend to the clinicians as soon as possible. So it's important you need to be aware of the symptoms. As soon as you figure out that there is something wrong, you go to the clinicians who have adequate knowledge and expertise to figure out what's going on. And once you start picking up early cancers, the outcomes will be very, very good. So in this current COVID pandemic, it is important that we don't ignore the symptoms, because a symptom ignored for 6 months might be a ticket lost for a train which has passed off early on. You must have lost, or you might have lost, an opportunity to get a cancer cured, and you might land up with a palliative setting where you miss the train and you're now in an advanced cancer stage. I think that is what I would like to say. It is important to attend to the symptoms and don't delay it. If there are symptoms, go to the doctors. I mean, you probably sometimes don't need the physical presence of the doctors, although we prefer that. But in the current times, your teleconsultations, your video consultations, your online consultations, a lot of these things help. At the same time, what I would like to emphasize to the general population, and especially to the population who are very well educated, IT savvy, is be careful of the Google doctor. Google doctor is very good at doing two things. One, there is a wealth of information. If anything, there is so much of redundant information that it will make you confused. You do not know what to pick and what not to pick. And the second thing is, it instills a fear amongst the general population. Let me tell you, ladies and gentlemen, if there are 100 people walking on the street, the maximum number of cancers in the adequate age group, with appropriate, symptoms is probably just about 5 to 7 cancers. This is the symptomatic group where they have symptoms of concern. But the other 95 odd people are normal. But what Google does is it makes a healthy, well person into a worried well person by instilling the thought of cancer. And it just makes them not only mentally unwell, but psychologically down too. So it's important to tease out what is a problematic symptom and what is a non-problematic symptom. It is important to separate the gold from the dust, and only a clinician with adequate expertise can do that. In addition to that, examinations are important, but we have to take both together when we have to look into what is a problematic situation and what is not.
Doctor, I would like to also ask one more question. Colorectal cancers, you are an expert in this field. How to differentiate between a common colorectal condition and a serious colorectal tumors for a layman to understand the symptomatic way?
True. See, colorectal problems are very common, widely prevalent, and colorectal surgery, clubbed with general surgery who practice a bit of colorectal, the gastroenterology practice is widely practiced. A lot of them do it. But the unfortunate thing in a country like India is it is poorly practiced too. When such is the case, there is lack of adequate standardized healthcare. Let me give you an example. Let me make it simple. You got a 40-year-old gentleman who comes to you with bleeding in his back passage. ಕನ್ನಡದಲ್ಲಿ ಹೇಳ್ತೇನೆ, ಒಂದು 40 ವರ್ಷದ ಪುರುಷ ಬರ್ತಾನೆ, ಸಾಹೇಬ್ರೆ ನನಗೆ ದ್ವಾರದಲ್ಲಿ ರಕ್ತ ಹೋಗ್ತಾ ಇದೆ, ಮಲದ್ವಾರದಲ್ಲಿ ರಕ್ತ ಹೋಗ್ತಾ ಇದೆ ಅಂತ ಬರ್ತಾನೆ. So this is a symptom that we have to be concerned about. See, if you Google, the first thing that might come up or that will come up is make sure it is not cancer. For a fit, healthy 40-year-old gentleman who has got some bleeding through the back passage, here we go. There is a big bomb that is dropped to his psychology saying that it could be cancer. That is where the problem starts. But what is actually required? There's a lot to go with the perirectal bleeding or bleeding through the back passage. Have we actually talked to the patient? Have we truly figured out whether a symptom is of concern or not? So a sensible clinician will ask, okay, sir, you've got bleeding. How long for? Is it bright red blood or is it dark red blood? Is it mixed with the stool or is it separate from the stool? Is it associated with pain or is it not associated with pain? Is it associated with the change in the bowel habit or is it not associated with change in the bowel habit? Is there a family history of cancer? Is there weight loss? So on and so forth. A clinician can easily tell that a fresh, bright red perirectal bleed associated with or without pain, not associated with change in the bowel habit, is probably related to a non-cancerous benign condition such as a fissure or a hemorrhoid, which is not of concern at all in a bigger picture. However, the same 40-year-old who has got some family history of bowel cancer, whose blood is mixed with the stool, and whose blood is dark red, is of concern. And this helps us to dictate what test the patient goes for. For somebody whom I'm concerned, I'll check his blood tests, hematological investigations to check he's not anemic, and I'll put him through a colonoscopy. For the person who I'm not concerned about, maybe I'll get a smaller camera examination called as a flexible sigmoidoscopy, reassure majority of the times, and the times we need to intervene in a non-cancerous benign problem causing some symptoms is very, very less. However, this 40-year-old with concerning symptoms needs thorough history, examination, investigations, if there is a suspicious problem, diagnosis, staging, tumor board, decision making, and appropriate treatment, followed by adequate follow-up till about 5 years time. So that is how different benign and malignant cases are. So it is very difficult to get away without a clinician's input, albeit we are tech savvy and we are internet driven and artificial intelligence, albeit there, but you cannot skip a surgeon's finger and a surgeon's decision making process or a doctor's decision making process. Hope that clarifies a bit of your question, Pawan.
Sure, sir. So finally, we would like to have one more small tips from your side. What would you recommend a good diet?
See, I think I always say this to people. The cause for all ailments and the cure for all ailments lies in the mother nature. And what we have been doing is we have been gradually destroying the nature. We have been paying less attention to the nature. We have been abusing the nature. We have been forgetting the traditional practices which were culturally accepted, which were very good for the mankind. When it comes to diet, we have indulged ourselves into ready-made foods, fast foods, speedily delivered, red meat, pastas, pizzas, kebabs, so on and so forth. The common factor here is food which is maybe tastier but not nutritious, not healthy, filled with oil, filled with cholesterol, filled with red meat, filled with additives to preserve these foods, which are carcinogenic. What they do is they damage the normal gut cells, and recurrent damage to these gut cells causes a cancer cell, a bad cell, to be born. In addition to that, lack of adequate fiber when it comes to colorectal cancers. Lack of fiber, excess fat, excess alcohol, red meat, obesity, lack of exercise. These are some of the factors that drive colorectal cancers 95% of the times. 1 in 20, about 5% of the cancers are genetically driven. So they have a familial component. There's not a lot we can do about it in the current context and time. But 95% are because of health related, because of the risk factors we expose ourselves to. The irreversible risk factors, family history, you can't do much about it. We all want to live. Longevity is a risk factor. We like to live, and that we can't do much about. Things we can do are healthy food eating habits, a lot of fiber, cut down on the red meat, cut down on the alcohol, cut down on fatty food, cut down your cholesterol, adequate physical exercise, stay fit, stay healthy, stay green, respect the mother nature. Try and get as much as organic food if possible. Grow it yourselves because you can trust the source. That is what I would like to say when it comes to diet, Pawan.
Thank you, sir. Thanks a lot. This was a very useful and very informative session, sir. Thanks for your time. And dear audience, please feel free to drop your questions if you have any in the comment section. We will get back to you with the response from the doctor. Thank you, doctor.
Thank you. Stay safe.